Good afternoon. Welcome and thank you all for joining us today. My name is Kari Siddiqui. I'm a project director here at the Schuyler Center for Analysis and Advocacy. For those of you who are not familiar with us, we are a 151-year-old organization based here in Albany, New York, but we are focused on statewide policy and advocacy. Our work focuses on policies that support children, families, and communities, and particularly those who have been historically marginalized. We are so excited to host this conversation today with an incredible panel of experts from around the state and focused on guaranteed income projects and their potential impact in the context of child poverty reduction. For a little bit of background and history, in 2021, recognizing the persistently high rates of child poverty all across New York State, Governor Kathy Hochul signed legislation, the Child Poverty Reduction Act, committing the state to the ambitious goal of cutting child poverty in half over the next decade. The act also included the formation of the Child Poverty Reduction Advisory Council, which is charged with tracking the state's progress and making policy recommendations to move the state towards its goal of reducing child poverty over the next decade and addressing those drivers of child poverty. At the Schuyler Center, we embarked on this series of panel discussions in June of this year. This is our fifth in the series of panels to highlight and elevate the issues connected to child poverty and to shed light on some of the incredible expertise that exists all around our state. Today's panel event will feature speakers from three different initiatives in three parts of the state. The Bridge Project, which is based in New York City and has expanded to Rochester and soon to Buffalo, New York. Hudson Up, which serves the community of Hudson, New York, a small city in the Hudson Valley and my hometown, and the New York State Office of Children and Family Services Direct Cash Transfer Pilot, which is a very new program operating in a few counties around the state in Westchester, Monroe, and Onondaga counties. Each of these projects takes a slightly different approach and serves a slightly different community or population. We hope that the conversation between these three will give you all, our audience today, a sense of the scope and variety of programs that exist here in New York State and across the country. We'll start with Debbie Priya from Community Service Society, who will give us a brief overview of guaranteed income landscape, and that will then move to our panelists from the programs for a discussion and overview of their work. At that time, I'll ask each of the panelists to introduce themselves and their organization, and then move into a conversation around their pilots. Please note just logistically that there is a Q&A box. Please feel free to put any questions in there during the presentations, and we'll have time at the end of the program for our panelists to answer the questions. So Debbie Priya, if you don't mind turning on your camera, and we'll turn it over to you for your overview.
Thanks so much, Kari, and thanks for having me. My name is Debbie Priya Chatterjee. I'm a senior economist with Community Service Society of New York. We are a 200-year-old organization devoted to looking at making lives better for low-income New Yorkers in city and state level. Today, I'm here to set the stage on where we are with guaranteed income programs and what do we know about them, and what are some of the ways that guaranteed income programs are expected to help in alleviating child poverty. So I'll try sharing my screen with you in just a second. So I hope everyone can see. I'll make it screen. Okay. So guaranteed income programs go a long way back. This quote from Martin Luther King Jr. in 1967, that he recommended it as the simplest approach. It's just like if there is poverty, giving people money helps alleviate poverty. And a little bit more of history for those who might be interested. This was followed by folks in the economics, like Milton Friedman, who are very pro-market, who are economists, and even by the Nixon administration to implement some kind of a program. They were calling it the negative income tax, where if your income falls below a certain level, you get more back, and so on. So all of that was tried. It did not go through because politics, and so here we are, getting out another chance to take a stab at guaranteed income programs. So what are guaranteed income programs? They are essentially providing unconditional cash transfers to individuals and households. The word unconditional is important here because that is what makes them distinct from traditional safety net programs. So you're free to spend the money however you see fit, unlike, say, SNAP, where you have to spend it on food items, right? And they do not require recipients to engage in any specific kind of activities, like you don't need to be enrolled in training or job or drug testing. So this is unconditional cash transfer for you. Here's the cash. Do what you want, what you see fit with it. The type of guaranteed income program that gets the most attention is the universal basic income. But most of the guaranteed income programs that we are going to talk about today and that have been piloted are way more targeted types. We are moving away from the appeal of universal basic income. We are trying to get the most bang out of these programs by directing it at folks that need it most, without encumbering them with some of the problems of the traditional safety net programs. So why do we have this renewed interest in guaranteed income programs suddenly? One, and this was the main reason until before COVID. The main reason behind the interest in guaranteed income programs was the accelerated adoption of technology, and something that has been set on warp speed with the improvements in AI over the past year, right? So what we were seeing is lots of displacement among skilled and both skilled and unskilled laborers and workers because of the accelerated adoption of technology. And what do we do during the time that the labor market adjusts? It's not to say that, okay, technology is going to progress and all the workers are just going to get guaranteed income to make them whole. It's just like when the market is adjusting, when we are adopting technology, how do we counter the hardship of displacement? That was the main interest. That's how Silicon Valley got involved, and so many and so that was pre-2020 story. And then COVID-19 pandemic happened. What it did was it kind of exposed and underscored the fault lines in our existing safety net systems. For example, there are assistance programs that require you to work to be eligible for them. How do you work when you are in a pandemic lockdown, right? So COVID-19 set us all back. We all took a moment to kind of rethink how to alleviate suffering and hardship in such extreme circumstances. And then we are now buoyed by the success of the pandemic era assistance programs. There were 3 rounds of stimulus checks, and there was a fully refundable expanded advance payment of federal child tax credit. And what all of that showed is that, the economic data that has been coming in has been showing that their unemployment has not increased, poverty declined significantly among children. So all of that has kind of generated a resurgence of interest in, okay, maybe unconditional cash transfer programs might work. So where are the ongoing programs being piloted? There's a link over here. It takes us to a site maintained that is a partnership between Stanford Basic Income Lab and Mayors for Guaranteed Income, another a portal that aggregates all these programs. As you can see in my screenshot, this is not even the whole list. It's over 30 cities in US, and reaching more than 8,000 participants in different forms, in different ways. If I click on New York City's Learn More Bridge project, who is in the house now, shows up. Similarly for Hudson Up and the programs in Ulster County, Hudson County, about which we look forward to hearing more. Okay. Guaranteed income programs, those were the pilots, but they have also been completed and studied in some of the other places. So here are some of the, it's a subset, it's not exhaustive, but these are some of the ones that for which we have definitive research on how the programs performed. There's Stockton through the SEED program. There's in North Carolina, there's casino dividend given to the Cherokee Indians. Finland decided to give $600 to unemployed individuals for 2 years. Barcelona and Canada tried something like minimum income programs. Interestingly, in Brazil, they in a suburb of Rio, what they tried to do was guaranteed income, but through a digital currency, which is especially good because that helps you track the kind of purchases folks are making and where they're spending. And probably everyone has heard about Give Directly operating a long-running program in Kenya. And in Alaska, there's the permanent fund dividend, which is from their natural gas and oil. The whole state, everyone in the state gets a check from that. So these are the programs that have been completed for over like last 40 years. So what do we know from them? What do we know how guaranteed income programs help? First, we will talk about workers, then we will talk about child poverty. The first thing that we know is they improve a wide range of socioeconomic outcomes. So while guaranteed income programs might not be powerful enough to pull people out of poverty and put them above the poverty threshold, what they definitely do is they reduce hardship, they reduce suffering, they improve the mental well-being, which goes on to reduce other effects, for example, anxiety, depression. They reduce domestic partner violence. They and educational attainment, all of the other usual suspects. But what I would also touch on is what are some of the subtler channels in which guaranteed income programs work. And one such channel is by reducing income volatility and improving financial security. So guaranteed income programs, they provide a floor for income floor for a family. And low-income households have been shown to experience income volatility, fluctuations in their income. The income goes up in the beginning of the month, and by the end of the month, they are really struggling. And this is compounded by folks who are now working in gig economy, and low-income individuals are increasingly being pushed into gig economy and less formal work. So for them, income volatility is very high. And it's really important to cushion that kind of a sway in your financial situation that you have, especially for children. And so guaranteed income program can do that. This works by helping parents focus their attention on children, on their needs. But otherwise, what they would have is, because they're in a constant state of crisis, it imposes an attention toll on them. It's researchers in Harvard, they call it the tunneling tax. Tunneling tax, because your tunnel vision focused on your immediate crisis. It impairs you to make long-run investments in your child's health, in your skills and training, and so on. So that's one channel. It helps recipients better negotiate benefits cliff. Almost everyone, I'm sure, attending this are aware of benefits cliff, where our safety net programs, because they don't talk to each other and they were developed in different silos, have very strong benefit cliffs. Your income increases through a job training program you take in, you are pushed off SNAP, but the income that you make is not enough to put food for yourself and your family on the table. So what do? And benefit cliffs are one of the main culprits for trapping people in poverty. Like, you really are wanting to make that leap into financial security, but you have so much to lose in childcare subsidy, in SNAP assistance or housing vouchers, that it is just not possible unless you win a lottery or something. And there are two other channels through which it helps families, which are by strengthening workers' position in the labor market. One is by straight bargaining. It's like if you have a floor on income floor, you can bargain for better compensation terms, better work conditions, and generally have a better workplace situation. And also, going back to the primary point I made, that it provides workers with much needed support to withstand changes in the labor market. Now we zoom into how these programs improve outcomes for children, and that is mainly through three channels. One is by immediate effect of reducing hardship, by making access to better necessities, better food, better clothing, better housing, better supplies, school supplies, better access to after-school care, and so on. So the immediate short-run alleviation of hardship and better quality, access to better quality basic necessities. And then it improves in the medium term, it improves the physical and mental well-being. When you have access to better nutrition, you are less likely to get sick that often. You are in a stable housing. You are less likely to miss school that frequently, and your parents are less anxious. Your relationship with them improves. They are more caring towards you. They are more attuned to your needs. So in the medium term, these are the channels through which children benefit, and then this shows up in the longer run as higher educational attainment, higher earnings, less involvement with criminal justice issues, less dependence on substance abuse or alcohol dependence. So, and all of these go on to save the state and the city and the government in millions and billions of dollars in later need for assistance. So this is something that we have to keep coming back to, reminding ourselves, because we are advocates here for policies that you're investing in the children. Such guaranteed income programs have been shown to have multifold returns on these. Now, let me address this probably not as big an elephant, but a little bit smaller elephant in this room. That do guaranteed income programs discourage work? They absolutely do not. There's a huge systemic body of rigorous evaluations that most guaranteed income programs do not discourage work or productivity. Workers did not reduce hours worked, or did they not compromise the quality of their work. Even unemployed folks, when they were given guaranteed income, did not take longer to find jobs. It just makes things easier for folks to get on with what they want to do. For example, data from Stockton shows that the full employment among recipients increased from 28% to 40% among the recipients of guaranteed income. Again, another question that keeps coming up: should guaranteed income programs replace or supplement existing safety net programs? Because our goal is to alleviate child poverty, the answer is absolutely not. Because even if the current safety net programs seem like a labyrinth of administrative, and bureaucratic regulations, they still are a very small percentage of the total cost for our program. So if you replace all of them, you are going to save a maximum 9% of the total cost of SNAP, Medicare, EITC, all of them combined. And that would not be enough. So the idea is to improve the design of their programs, because even now the current programs like SNAP leave out 3.4 million children who are in abject poverty. TANF leaves out 9 million children in poverty. Before asking for we have talked about expanding the full refundability of the child tax credit. That was leaving out the households that needed them most. So the idea is to work with the safety net programs, improve the design, and see guaranteed income programs as a supplement for that. Thank you very much.
Thank you, Debbie. That was so helpful, and so helpful to think about kind of the landscape and the potential for impact that these programs have. So I'm excited now to turn over to our program panelists. If you all can turn your cameras on, that would be great, so folks can see you. We'll start with just hearing a little bit about each program from both the participant side and from the program side. So we'll start with the Bridge Project, and we have Steph and Morellis with us today. And Steph, if you can tell us just a little bit about the Bridge Project, who it serves, how families are connected to it. And then Morellis, we'd love to hear from you about your experience with the Bridge Project and how participating has impacted your family. So I'll turn it over to the two of you to converse. Thank you.
Yeah, thank you so much, Kari, and the Schuyler Center for hosting. My name is Steph Sokowski, and I am the Director of Policy and Strategic Initiatives at the Bridge Project. The Bridge Project, as you might be able to guess, is a guaranteed income program focused on supporting low-income pregnant and parenting folks and their babies from the very critical prenatal period through the first 3 years of a child's life. We now have over 1,000 participants in our program scattered throughout the 5 boroughs and in Rochester, New York, and very soon, in about 10 days, we will be in Buffalo, New York, which is very exciting. And over the last 2.5 years, we've put 30 million in private dollars directly into the hands of low-income families in New York. Very kind of broad strokes on the design of the program and eligibility and how we find folks. The infrastructure and the design is relatively simple. We offer unconditional flexible cash on reloadable debit cards every 2 weeks, beginning in a participant's late 2nd or 3rd trimester, and again, continuing through the first 3 years of a child's life. We also provided upfront prenatal stipends, sometimes known as a baby bonus or a birth grant in other programs at the start of the program, in addition to regular monthly payments. And participants in the program also have access to a dedicated community manager who provides benefits counseling, light case management, and wraparound support. When we first launched the program in 2021, we found moms and recruited participants by putting up flyers across high traffic areas of the city. And as you might be able to guess, many folks thought it was a scam at first, but over time, we focused on developing really strong partnerships with hospital networks, city and state agencies, WIC clinics, trusted community-based organizations who refer participants to our program. And we keep the application process really simple and accessible. We don't have overly complicated eligibility requirements or ongoing programmatic obligations, which allow us to serve a wide variety of families with a wide range of both short and long-term needs. And then to kind of close before I move to Morellis, who can talk about the program much better than I could, the goal for us is to provide financial stabilization to a family during the earliest and most critical days of a baby in a family's life to support healthy development, both for the pregnant and the caring person and for the child, to avoid adverse childhood experiences, break intergenerational cycles of poverty. And as an organization, we landed on unconditional cash as our primary intervention because of its simplicity and the freedom and dignity it offers families. And really, I think the beauty is in its flexibility. We have participants who've used the cash to access better prenatal care, to stay home with their baby for longer postpartum, to access stable housing and move out of shelter, or to leave an abusive partner. And that is really the power of a guaranteed income. So Morellis is the better representative for us and for our program. So I will turn it to her next.
Hello. So the question was, how does Bridge Project impact me and my family? I want to say that Bridge Project impacts my family and I in a positive way, tremendously, in regards to childcare. And as Steph mentioned, prenatal care, nutrition was a big factor. And when people think about babies, you just think about diapers and milk, but there's much more to that. There's clothing, there's towels. You know, my baby, for example, has eczema. I'm a mom to an 18-month-old, and there's a lot of needs for babies. And daycare, choosing a good daycare for your child is super important. Like I mentioned, clothing, hygiene products. How else have they helped me? I feel less anxious. I have 4 brothers. I have no sisters. My mom has retired to her country, to the Dominican Republic. I felt alone. So Bridge Project kind of took that load off my shoulder with stress. It's guaranteed income, and they have been more than helpful for me and my son.
And Kari, if I could jump in too on, I think the final thing that I'll say from the Bridge Project side, is that I think what if folks could take away anything from our perspective in this conversation today, I think understanding some of the barriers that guaranteed income programs like ours face, in my perspective, are less on kind of the how do you do this thing and more around the why do you do it. We get told very regularly by folks that the work that we do is like very radical, and that not running like an overly paternalistic, high barrier, hugely judgmental program is like the radical thing to do. And I think a lot of us, even in New York, a state that kind of dreams big and accomplishes a lot, I think we think of child poverty and maternal health as unsolvable problems and problems that we just have to live with and maybe tinker at the margins with. But I think that, to me, our biggest collective barrier on guaranteed income is just wrapping folks' mind around unconditional cash and trust and dignity and liberty, and that we could actually trust families to make decisions that are the best for them and not tell them how and what those decisions are. And I think that problem for us at Bridge and for us collectively is certainly not an insurmountable one. It is just one that is a political and an organizing challenge and a real opportunity for us going forward.
Thank you both. That is really wonderful. I'll turn it over to Joan Hunt and to Mrs. Campbell from the Hudson Up Project.
Hi, everyone. So just a little bit about Hudson Up. We are a guaranteed income program here in the city of Hudson. Our 3 criteria to engage with the pilot are that you're over the age of 18, live within the city of Hudson, so the 2.2 square miles, and earn under the median income. So our pilot launched in 2020, convenient timing with the COVID pandemic. It wasn't actually the plan, but it just kind of happened that way. And so our first disbursements went out in October of 2020. We then have launched 2 additional cohorts in 21 and 22 for a total of 128 participants that receive $500 a month for 5 years. That is actually over 5% of the eligible population in our community that's receiving this guaranteed income. And so many things, resonated with me from the other panelists, but similar to what Steph was sharing, we really believe in financial freedom and allowing folks to make decisions that are best for them. And so we also kept our enrollment into, our lottery process very straightforward, a few questions, really a trust-based process. So, we didn't ask for a ton of verification of the things that we were asking folks. The only thing we did ask for was proof of residency, so a piece of mail. But we have seen, and we'll get into this a little bit more, but just incredible transformation for families and access to resources that weren't available to them before. So for those of you that don't know, the city of Hudson is a small city, but it's couched in a very rural landscape. So access to stores and childcare and medical appointments is not that easy for families. So we have seen some of our participants be able to purchase their first vehicle, for example, which has been transformative. And so when we started, the project was in partnership with Humanity Forward Foundation. And since that, we have transitioned the pilot to be housed locally at the Greater Hudson Promise neighborhood, which is a community-based organization here, provides a lot of other wraparound cradle to career services in the Hudson community and beyond. So one of my questions was around like how this is couched in other supportive programming as well. So while Hudson Up is a strict UBI pilot, we are, as an organization, providing supports to the community that include participants in our pilot, but it's not directly connected to, it's not like a condition of the pilot that participants are participating in other resources and programming as well. So I will now turn it over to one of our Hudson Up ambassadors, Mrs. Campbell, to share more.
Hello, everyone. I wanted to just touch on Morales, when you spoke about, eczema. My daughter's actually 30 years old, but when you said that, I thought about that. I remember when she was diagnosed and she was a baby. She was like 6 months, something like that. And the doctor said, oh, get some Aquaphor. So I'm thinking, okay, I can go to the store, I could get this. I go to the store and I tell the pharmacist, I said, I'm looking for Aquaphor. And oh my gosh, it was like at that time it was $17. And I said to myself, what am I gonna do? Where am I gonna get $17? So I understand Morales, I get it, and that's a good point. And everyone needs to know that children are born and thank God they're healthy, but there could be other issues. And if you're not in that financial situation, it's challenging. So, you know, on that point, I get it and I really appreciate it. It has definitely been a positive experience for me. It was just so weird the way it happened. I was strolling through my phone and I see this announcement, this application, and I go, I'm not doing that. I was like, because they probably want 50,000 questions. They're going to want all this information. And I strolled and I didn't do it. I'm strolling through my phone a couple of days later. This is the last day. So my mind said, why not? Look at it, see. It was like 3 questions. I was like, 3 questions? I'm like, I could do this. So of course, you know, I did it. I get the phone call. It was such a blessing. I could not believe that someone was giving me that $500 a month for 5 years. And I didn't have to report. I didn't have to do anything. So it opened up a lot of options for me. At the time, my husband was sick with cancer. So it was an answered prayer because I said, okay, I have this situation I have to deal with, but I can breathe through it now. Okay, so I'm not in my bed thinking, you know, I gotta take care of my husband and how am I gonna get this and how am I gonna pay for extra or all the things that come with that situation. So yeah, it's been very positive. It has really changed my life. It has opened me up to things that I didn't think about. You know, I think when you know, when you get an amount of money like that, and it's just, I don't want to say free, but it comes with a responsibility because after everything wears out, then you sit down and you be like, okay, now I've been blessed with this. So now what can I do? How can I help? How can I make myself better? How can I educate myself, my community, my family? So the money goes beyond just me. And that's what we want to get the world to see, because with that money, you can help others, you know, through other acts of kindness. So yeah, I love it. I just think that if we can really get the right ears and the right people on board, then we can make a big difference in this world, starting with one community at a time.
Thank you so much. It's so powerful to hear from all 4 of you, from all the different perspectives. And one thing that I keep hearing that's just like reinforcing what I'm hearing in my work also is about kind of removing barriers, including like paperwork, right? Including removing some of those barriers that make it just harder for people to access things that really will help them. So thank you for that. I'm going to turn it over now to Candy, who is from the New York State Office of Children and Family Services. So talking about their new initiative. So,
Hello, everyone. Thank you, Kari. Candy Griffin Jenkins here. I'm the director of our program, our Social Determinants of Health Bureau, which is a new bureau out of the Division of Child Welfare and Community Services. So I'm so proud to be here, and it feels really different to be here from the state perspective, right? Because everybody else is coming from, you know, local community organizations. So I'm really proud that New York State has jumped on board, has seen what this initiative and pilots, other pilots are doing, and the lives that are being impacted, and that we could also, bear witness to this and be part of it. So our program is a little different in that we did not have an open opportunity for people to just, apply. We actually identified people through an alternative. I'll say it as an alternative for, families who maybe were identified for being at risk in some way, and not at risk to the point where there was danger, right, to the children, but to the point where, through whether it was poverty or, otherwise there was maybe a neglect or some sort of opportunity that was needed where there was supports needed. And so we were able to work with the 3 counties of Onondaga, what are my counties? Onondaga, Monroe, and oh my goodness, I'm so sorry. I knew that there's so much going on in my head, so I just need to take a minute to breathe a second. And because we work with so many different counties on different things, so I apologize for getting caught up here. But the 3 counties that Carrie, you actually said them initially, right? So we're going to just move on. So anyway, we're working with those 3 counties. We identified 150 families, and those families are all getting $500 a month for a period of 1 year. Right. And that is done in conjunction with a number of different partners, but we're working with CGIAR on a randomized control study. And thank you. I see you put it, the Westchester, Onondaga, and Monroe. Thank you so much. And so, we're looking to just see the impact of those funds on those families for the 1 year. And if having that additional support will actually decrease opportunities for families to be engaged in the child welfare system. So that's our, pilot in a nutshell. And I feel awful because I don't have anyone with me, right? It's just me, talking. We just launched our pilot in July, so it's very new, as you said. And we are we distribute the funds monthly through a card as well, like others I heard. And I'll stop there and just see what else. Yeah.
Thank you, Candy. And we're so excited to watch this initiative as it grows, given that it is so new, and we're excited to see, as it expands and grows and what the impacts are. So we're very excited. Thank you. So we're going to turn over to questions, and I would invite the panelists, as questions arise for each other. Also, feel free to let me know or jump in. But the first question I have actually is for Joan, but I'm sure others might have responses on this too. And Debbie touched on this a little bit at the beginning during her remarks, but it's the question of work. So we're a nation that it very much values our work and our self-reliance and this idea of people, really being dedicated to the workforce. And concerns have been raised by some that UBI or guaranteed income can discourage workforce engagement. And I'm interested to hear what you're seeing and kind of your thoughts and your perspective on the ground.
Sure. So before I get into any of the stats, let me just say that nobody's living off of $500 a month in this country comfortably. So let's just put that out there. And then I'll go into just some of the numbers that we're seeing from our very early study. So I mentioned we have 3 cohorts. We have completed our year 2 report and are getting ready to release our year 3 report. So for our year 2 report, what we found with our cohort 1 participants is that our employment rate rose by 72% above baseline for cohort 1 and 150% above baseline for cohort 2. So really strongly suggesting that actually people start working more when they have this floor and some dignity and some freedom to maybe find jobs that are more meaningful to them, or they're willing to take risks and go for a job they might have not gone for before because they were worried about not working for a period of time. So we're seeing that. And we also, for cohort 2, are seeing that when we started the pilot, we had 16% of our participants reported working. And then after wave 1, which is just, I think 4 months into the pilot, 40% reported that they were working. So we're seeing really, really strong data across the board in terms of employment rates. And I know this is happening all across the nation with the pilots that are being studied. So I really, really hope we can move on from this conversation and not have to keep answering this question because I don't know how many thousands of research reports have to come out that say the same thing for folks to believe that it's true. But yeah, those are some of the things that we're seeing just in terms of work and employment numbers.
Thank you. That's so interesting. I love thinking about, that this little bit of income gives folks the flexibility to pursue things that they want to pursue or to kind of, make their own choices about employment in ways that are true to themselves or give them a little bit more flexibility. Does anybody else want to weigh in on that before I move on to my next question?
Yeah, Kari, I would love to jump in just in total agreement with Joan. We see the same thing in our program. We see a lot of the moms in our program leaving really unstable gig work for more stable, high earning jobs. We see moms in our program spending cash on things like courses or additional certificates to be able to move up on the economic ladder. And we also just hear from our program, which is hard to quantify, and so we get it through kind of stories and conversations, that receiving cash in this way that promotes dignity and trust really builds our moms' confidence in themselves. Again, this idea of like being able to dream bigger for themselves, for their baby, for their family, in a way that it's hard for folks to wrap their head around, but for the first time, a program and people are saying, we trust the decisions that you make. We know that you're going to do the right thing for your family. And that alone, I think really allows folks to think about their family and their community a little bit more in a way that I think is particularly special and unique about a dignity kind of trust forward program like a guaranteed income.
Our program is still so new that we're gonna wait and see how it goes.
Is that something that you'll be kind of looking at as employment?
Absolutely. Well, I don't know if that's one of the questions. I know that CGIR, Center for Guaranteed Income, they're going to be responsible for, vetting the responses. And I'm not sure if that's a question on the survey or not, but if so, then we'll certainly, look further into that. Yeah.
Mm-hmm. That's great. Morellis, I'm wondering, changing gears just a tiny bit, if you can speak a little bit from your experience about how participating in this project has been different than, for example, participating in programs like SNAP or WIC or other kind of public programs. Oops, you're muted still.
Can you hear me now? In correlation to education, what we were just speaking about, being alone in the country, so to speak, because my parents ended up, retiring in a different country and I don't have any sisters. Having my education at a bachelor level always made me doubt, is this enough to have my first child? Because it's not just food. So in terms of SNAP, where it's just food, this is more towards the baby's needs, which is not just food, like I said. And also SNAP and WIC, they require a lot of certification paperwork. They'll often ask for pay stubs. They will ask for vaccine reports from the baby. So Bridge Project, the difference is it's guaranteed. It's always there, and it's just very helpful.
Mrs. Campbell, I wonder if you can speak a little bit to this question as well. Like, how you touched on it a little bit at the beginning, but like how has participating in Hudson Up been different than participating in other kind of public benefits programs, SNAP, other things like that? What has that experience been like for you?
Freedom is amazing. Because like Mavala said, when you have SNAP, which I did when my daughter was a baby, because you need help, you know, you do need help with food and with Pampers and with milk, because you can't afford to buy this stuff on your own. But there's always that requirement, you know, so you're always thinking, okay, can I do this? And if I do this, will this affect this? And am I under the line? And you know, you don't want to go to an appointment and then they like, okay, well, you make $1 too much. But I have a baby that requires more than $1, you know? So with the $500 that is being received by recipients, I'm sorry, I'm trying to, it is a saving grace, because you can have that money in addition to what you are receiving, which gives you the option to look at your child's future. If you don't want them to go to public school, you can invest in private school if you want, or a specialized school if you want. You can save for their future. So there's a lot of options there. And for me, the key thing is hope. We have to give people hope. We have to let people know that, you know what? We're bringing life into this world, you know, but that's how, so you can look at the now, but we're not going to live forever. And these children are our future. So we need to invest in them. And by investing in them, we have to invest in the parents. We have to make sure that the parents are okay, mentally, physically, emotionally, financially. So many women, even I could just remember being stressed as working 2 jobs. Wouldn't it be nice to work 1 job, go pick your child up from school, or to be there when your child get home from school, and you're in there, you're making, you know, you're getting dinner, you can sit down and say, your child, how was your day? You know, listen to your child, see what concerns they have. Just so much time. It just opens up so much. And for that, I'm very appreciative and grateful. So, yeah. I just feel like whatever conversations we need to have, because it needs to be understood. It really does. I hope I answered.
I love that quote I wrote down. Freedom is amazing, right? That's like, so that's the freedom and dignity to make your own choices, which is what I'm getting from you. Thank you. Steph, we heard at the beginning of the conversation about the impact and scope of guaranteed income pilots and projects, and their potential for fighting poverty. I'm wondering what, in your experience kind of working through these programs, what policies you see that might be implemented at the state or local levels to help bring these to scale, or what are the barriers to bringing it to scale?
Yeah, I love this question, because I think for us at the Bridge Project, we are very interested in long-term sustainability and scalability. And our perspective is that a guaranteed income program like ours, which to date has been entirely privately funded, and focused on a very specific population, again, pregnant and parenting folks and their babies, really must be publicly adopted and implemented in order to reach the really vast need in our state. And I think very plainly, you know, we at Bridge care about getting more cash into the hands of pregnant folks and young families, but there are a wide variety of avenues that one could explore to achieve that goal. And there's avenues that use existing infrastructure and agencies, and avenues that create something entirely new. And I think there's pros and cons to considering both of those approaches. One such approach is laid out in a bill in the state legislature called the Mothers and Infants Lasting Change Allowance Bill, which is prime sponsored by Senators Jessica Ramos and Samara Brook, and Assembly sponsors Sarah Clark and Chantel Jackson. That bill creates a 15,000 participant pilot program based on the Bridge Project's model, with a particular set aside for rural communities. That bill, if passed and enacted, would provide low-income pregnant ED workers with unconditional cash payments beginning prenatally and continuing for 18 months. So it's a little bit of a shorter time frame than our direct service program. And that bill, which we introduced last session earlier this year, received support of 20 state senators last budget season, which was great. And we're really excited to continue organizing for it this session. And I think if you care about solving in our mind, like the twin pillar problems of child poverty and maternal health, then this bill is certainly one that I would encourage you, your principal, your organization to support. But I also just want to say that there are other policy approaches that one might consider, such as a more time-limited approach than our direct service program, or even that is in the bill that I just named, potentially even just a one-time prenatal payment. One could explore more narrowed or targeted eligibility, or an increased child tax credit amount for the youngest children, the latter of which relies on existing infrastructure like the tax credit system. And I think for us, any new investment in New York's families is a good thing. And we are really committed and excited to work strategically with folks on this call and folks not on this call, both like very thoughtfully and also really flexibly to see what we can get done this upcoming year, which I think is really going to require the building of political and organizing capital to not just lay out the research and the data around the success of these programs, which has been around for really decades upon decades, but changing hearts and minds around unconditional cash and trust and dignity. And then building in future years. And that's what we're really excited about. And I think kind of my policy takeaway for folks is that, thinking very flexibly around what the design of these programs could look like, not being too wedded to one thing, and hopefully I think working collectively and really like solidaristically to get more cash in the hands of families this year and keep building and building. I think the fight for a guaranteed income, one that is like broad and vast, might to some folks feel like a long fight, but I think it's totally within our grasp. We just need to kind of come together and set the stage for it this upcoming year.
Steph, there are a number of questions in the chat asking if you could just repeat the name of the bill or the bill number and the sponsors, and also maybe just put it in the chat.
Yes, I will put it in the chat. It's S4578. I'll put the link in the chat. And I see, I won't shout them out, but I see folks who are participating as staffers of sponsors of the bill. So shout out to you all for already being behind this bill. Very thrilled for it. And let's get some more on board.
Thank you. And I want to pose the same question to you, Joan. Like, what are you seeing as things that the state could do to kind of work on taking this to scale, and what are the barriers that you're encountering in terms of scalability of these kinds of programs?
Sure. So I think something I would like to see statewide, but also nationally, is benefits waiver legislation across the board for all basic income pilots. That's something that all of us are struggling with on some level. So if there could just be like, in an ideal world, like a blanket bill that just gave everyone a waiver. I know there are certain programs that are a little more harder to navigate than others, but I would love to see some benefits waiver legislation. And I feel like that might be something that feels more tangible than some like broader nationwide UBI legislation. But I loved hearing about your bill, Steph, and what you all are doing. I would obviously like to see, like in our world, a little more universal, because obviously there are folks in every stage of their life that could benefit from this. And so what we did with our pilot, and what I would love to see scaled on some level, is like a weighted lottery system. So we looked at data from the Opportunity Atlas data set and looking at our community and thinking about the folks in our community that have a better or a tougher, have been dealt a tougher, hand in life. And so we weighted our lottery based on race, economics, and gender. And then we gave folks sort of a higher chance of being selected in the lottery based on that. So something like that, I would like to see implemented as well. And I know it's so interesting to learn about what pilots are doing in terms of their target group of participants, but I would like to see something like that includes those different factors. But I don't have any specific legislation or bills that we're behind at this moment.
Thank you. And so this has brought up a lot of questions in the chat. And so I'm going to kind of weave in our Q&A section here because there have been a number of questions about how all of your programs interact with programs like SNAP and WIC and eligibility. And you touched on this a little bit, Joan, but kind of the eligibility cliffs and how programs are kind of dealing with those to make sure that participants don't lose their eligibility for other programs. So I'll pose that to all of you all to answer anybody who wants to.
Sure, I'll jump in just to follow up on that. So our local Commissioner of Social Services has been an incredible supporter and advocate for Hudson Up. And so he did everything that he could on a local level to get waivers for benefits programs locally that he had jurisdiction over. And then we developed a system through our benefits counseling that we offered every 128 participants where we would call anonymously. We had caseworkers assigned to the pilot that I could call with anonymous information on a specific participant. So say I have a mom of 4, this is what she's receiving currently. How will this $500 a month impact her benefits? And then I would, sometimes we get, okay, they're going to lose $11 in food stamps. The participant is in that situation typically inclined to, take that and receive the $500 a month. We also did something within our pilot that if somebody was not comfortable with whatever the impact would be, they could designate a family member or somebody in their, close friend group to receive the $500 instead of them, not on their behalf, because that would not be legal, but they could choose somebody to receive it instead of them. So we gave that option. And then, like I said, with the benefits counseling, just tried to run scenarios for each participant.
I'm happy to jump in as well. I mean, that was one of the areas that we worked really hard to establish. We worked with our partners, YRI, who actually did the onboarding of the families, and they provided the benefits counseling. They utilized the various tools that were out there, like the Atlanta. There's an Atlanta, I can't think of the full name of it, but that, where you put in the actual, like what folks were receiving, and then they were able to kind of get a sense that way. We also were successful in getting a waiver from working with OTDA for, SNAP and TA. And then I know the governor in December of 22 also signed a bill that, exempted certain income. So that was very helpful and very encouraging to see that happen. But we also at the state of New York established a Hold Harmless Fund so that, should families, see that they were going to be losing some benefit, that they could get up to $500, one time. I mean, I know it's not, might not cover, a persistent loss, but we did want to at least, fold something in that could potentially, support them throughout and maybe prevent them from not taking advantage of it should, they see. And my understanding is from working with our friends over at YRI that, thankfully there was minimal, because we were able to get, some of those waivers and work with families to kind of figure out what might be the impacts, and they were able to make, informed decisions that way. So, but I was really thrilled when Debbie mentioned the benefits cliff, because that for us was definitely one of the bigger barriers, and frankly, something that, someone else, I think maybe Joan mentioned, has been around. This is not new. And so it's very frustrating to know that, like, here we all are with our various pilots and various communities that we're, trying to support. And, folks can't take because they then may lose something. And stuff like SSI, like those federal programs specifically, right? Those are not, you lose that, that's it, so that was really challenging. And we were not, as successful, trying to work in that way. So my hope is that something does come down the line that will provide that opportunity for folks who are on SSI, SSDI, right? Those housing specific programs that are a little bit harder to engage, that those will also be part of, the solution as well. So.
Yeah, and I'll just jump in briefly. I mean, I think broadly guaranteed income programs relate to benefits protection in kind of three primary ways. There's kind of like radical transparency with program participants. There's pursuit of legislation, local, state, or federal, and there's the pursuit of waivers. And some programs use all three avenues to protect benefits. Some, depending on kind of their local agencies, decide to pursue one or the other. We have pursued all three for different avenues, and I'll just name that. At the city level, we passed legislation in the spring that protected all city benefits, and that was sponsored by Councilmember Crystal Hudson with the support of the Speaker, which was great. Obviously, city benefits are only one category, but we pursued legislation to protect those benefits. Candy named the state legislation that Senator Brisport passed and the governor signed. And so I think there's pursuit of legislation, which can be tricky or really opportunistic, depending on the political contexts. The pursuit of waivers from state agencies really can run the gamut, from being like very possible and very timely to taking many, many months and a very long time. And so if you are not willing to kind of hold your program, and to kind of wait and see, then most programs tend to include some sort of like radical transparency with program participants. And Candy, the resource that you named is the Federal Bank of Reserve in Atlanta. We were the first program that built the calculator with them, and so we use that. We do onboarding all in-house with our team, so we walk participants through all of those things. And the last thing that I'll say is that federal benefits are definitely the trickiest, and disability insurance in particular is the one that we see program participants at most risk of losing, and we tend to counsel them to not join the program if there would be a significant net loss. But again, in kind of the spirit of agency dignity and trust, what we try to do is lay out everything for participants and allow them to choose what is best for themselves. And oftentimes, if it is a minor loss or a negligible loss, they would much rather have the flexible guaranteed income that requires no ongoing programmatic obligation. So those are kind of various approaches, and programs, again, sometimes pursue all three of them, sometimes pursue one, and it looks very differently in other states as well.
Thank you for paving the way, because they were fantastic to work with. And I believe that it really was very helpful with the participants in weighing their options, to have a thing that they could actually look at and, type numbers in and see in real time what the benefit, impact could be. So that's great to hear. Thank you.
And it's so great to hear how everybody is addressing these challenges, like taking them on head on and addressing them, for your own communities and for your own projects. And I hope that we continue to work to identify statewide solutions. Candy, I have a question for you, which is that as you talked about, the Office of Children and Family Services is taking on this work at looking at how the state can increase support for families.
Yes.
Through this pilot. And we're interested in just your thoughts on how the state can take on more of this work, what other agencies could be involved in the work, and kind of lessons you've learned through the work of implementing this pilot for work moving forward.
Yeah, thank you for the question. I mean, there's so many lessons learned. First off, I mean, just, the things like the name, right? Like, who knew that it would be such a thing to figure out what the name could be, right? Be a New York State agency. I don't know if others, had similar, challenges, but we certainly learned that it's no small feat to decide, okay, we are going to give, funds to folks and trust them, to decide, how they need to use those funds, given, you know, the systemic ways that, you know, we have done this, right? You know, here's money for food, here's money for this, and, you know, again, benefits cliffs, et cetera. So you know, again, many lessons learned. I think that because of the nature of our study, right? That, and I'm so, you know, excited again that we're working with CGIAR and others who know, you know, the guaranteed income world, and have been able to really pour into us and really help us to figure out and navigate the waters. Part of the reasons why we as a state agency had to bring in an alternative, you know, entity, YRI, which I mentioned earlier, is because we couldn't just go through our regular channels and do business as usual, frankly, right? We had to be creative, we had to be persistent, we had to advocate, you know, for making this happen. And it took, I think, you know, maybe close to 2.5 years to make it happen. And the deadline kept getting pushed. So flexibility was one of those lessons. You know, someone said that earlier, right? Like recognizing that, you know, we may have this amazing, you know, thought and concept, but how do you take that and turn it into something that actually happens, is a whole nother thing, especially given all the bureaucratic, you know, red tape, et cetera, that, you know, we had to kind of to cut through to get to the other side of that. But that's where the OTDAs and, you know, the other agencies, we work with so many amazing, and because, you know, my memory at 3 o'clock, not to be trusted, right? Like I actually wrote myself to make sure that I'm giving everybody, you know, their due, but like, you know, OTDA, again, the Center for Guaranteed Income, UPenn, right? Redlick Foundation, and then again, Youth Research. It took all of us. And then within the Office of Children and Family Services, you're talking child, you know, welfare, my area, you're talking our research team, you're talking our lawyers, right? So all of those things, right? So I'm sharing that just to say that, you know, the lessons that we learned are still going to be forthcoming because of, you know, ours is a pilot, ours is research based, of course. Just like everyone else's, and we're hoping that, you know, this 150 folks that are receiving, you know, the funds will tell us a story that proves, you know, what we hope, you know, is that just having that support additionally will, you know, will decrease opportunities to get involved with the child welfare system. We're hoping that those folks who are not getting the funds, that 150, because ours was 300 total, that 150 folks who are not getting it, but still, again, telling a story, that they too will, you know, feed into the larger narrative that, you know, policies need to change, and we don't want to do the status quo anymore of just protect. Of course, protecting is very important, but we want to strengthen families. We want, right? So those are the lessons that we're hoping to gain from this research, and we're most importantly, Joe, you know, you mentioned the hope. Right? We want to instill hope, not just for people individually, that's so important, but also we want people to have hope in our systems again. We want people to know that, you know, there are faces behind the bureaucratic state, you know, especially Office of Children and Family Services, who, you know, let's be honest about the impacts, right? People hear that, they don't always think positive things, you know, frankly. We know that there has been harm historically. We know that, you know, all of that has happened. So we are learning and we are growing, and we have been so grateful for all of the other partners who have contributed and provided us, you know, information. And we hope to continue working to, at some point, maybe scale. But again, because we're so, you know, new, some of those lessons are still forthcoming, but it took an incredible army of individuals, very talented and very, you know, crafty to figure out how to make it work. And you know, we're still in the midst of it, but looking forward to seeing, you know, where we are next July, which will make that year. And then, you know, 6 months thereafter to kind of conclude and come up with the reports and things like that, and see what we can do to, you know, maybe impact some of the other larger initiatives, both federally and statewide. So we'll see, but hopefully that answered all the aspects of the question. Yeah.
It certainly did. And Kitty, I wonder if you might want to just mention the Bureau of Social Determinants of Health, which I think
absolutely. So our bureau is brand new. Literally, you know, when I joined, and I'm a social worker by trade. So, you know, hope is is my profession. And, you know, was asked to figure out, you know, what the contribution could be. It's like, you know, and I knew, you know, given what OCFS, the changes that we wanted to make, going from, you know, that protection to strengthening and closing that front door a bit, and, you know, all of those things that, you know, we've been very consistent the past few years. Mandatory trainings are changing to include trauma and ACEs and all the, right, these things, these catchwords that we now understand are very real consequences for people in their everyday lives. So anyway, our bureau was created to address the systemic inequities that negatively impact, right, the economic stability, educational access, quality healthcare, and the environment, the very things that people are dealing with every single day that makes a tremendous impact in their ability to live, breathe, work, you know, be well, be healthy, to be present for your family, to be present for yourself first, right? And so I'm really thrilled that, you know, our division has prioritized this and has made not just the talk of it, but actually created a space where we can actually use that lens of social determinants of health to impact those policies that, you know, we're looking to see change, you know, in the next few years. So thanks for asking that question.
That's so exciting, and it's such a, you know, it fits in so well with all of this work that we're talking
Yeah,
about.
absolutely. And and to your point, when I heard, and full disclosure here, I mean, I'm speaking on behalf of myself right now, but when I heard that, you know, the Office of Children and Family Services was piloting a direct cash transfer program, it blew me away. You know, I couldn't believe that we were doing this, right? And the fact that, you know, we were adding that to the laundry list. I actually have a list of other initiatives that are either happening or in the works. Just shows that there's real commitment and dedication to making, you know, some serious changes that, you know, I hope will make, and not just myself, but our whole division and bureau is looking to make, you know, for our families and the folks in New York State. So, yeah.
That's great. So in the spirit of like thinking about community and how, you know, families and children exist in community, I have a question for Mrs. Campbell and for Morales. That thinking about as your experience as someone who's participated in a guaranteed income pilot, can you speak a little bit about what you think a larger and more permanent project might mean for your communities and families who live within your communities?
I'll jump in. Well, to see our community expand from being able to feed our children to getting educated, to show our community how to take care of each other, and bring each other up. You know, you'd be surprised, at least I'm not though, but when you put money in people's hands and they're in a close-knit community like Hudson, you will see the difference. So if you have that elderly person who 2 or 3 days before their check comes, don't have no food, you can literally say, go to the store. I love the fact you go to the store, somebody has groceries, and you say, you know what, I'll take care of that for you. That's hope. Hope grows. You could build on hope. There's so much you could do with the blessing that you have received. So far as your community, you know, when I forget the woman name who talked about Martin Luther King, I had actually wrote that down. What was her name? Debbie, sorry, Debbie. I had actually wrote that down because where do we go from here? Chaos or community? You start one community at a time and you will be surprised. Like John was saying, like people, they're buying cars, you know, they could pay their rent, they could sleep at night. They can think about educating themselves further. There's just so much that could be done within your community to build yourself up. And as you build yourself up, you build your community. So we want hope. And I want to say thank you to all the directors who are really fighting the red tape. And that's, you know, it is what it is. But I'm so grateful for that because one of the communities that I think about is the elderly, because they are vulnerable and they may not accept this because of the benefits that they get. So this fight is a good fight, and we have to continue to do that. But I'm grateful to the organization, the directors, for fighting for that cause, and hopefully we'll see results beyond all above we can ask or think. So yeah, I hope that answers your question.
I agree. It does start with hope, and it does start with the community. I believe that Bridge Project, I feel like we're centered here on like the money aspect of it, but for me, it was a lot of the mental health aspect of it in regards to like support, having that backup team. Bridge Project also gave me the opportunity to reach out with other local moms. We have a Bridge Project community. So it does start within the community. I think bringing this on a larger scale would benefit so many mothers, so many mothers. I too thought it was a scam. When I first saw the flyer, I was downtown, heart of New York in Manhattan, looking for non-clinical positions, because like I said, I'm at a bachelor level. And, I didn't wait the last day like you did, but I called, I submitted the form, and I got the call, and it felt like winning the lottery, like you said. And it's true. You have people that will help you, you have backup, and you have a support system. So I think on a larger scale that this would absolutely make a difference in the state of New York.
Thank you both. I really appreciate it. It's so important for us all to hear your perspectives as people who have, been through these programs and are in these programs. And it is so helpful for us all and so meaningful. So I thank you. We have a few minutes for some questions from the audience. Or questions from one panelist to another, if you have questions for one another. I will start with one that I thought was interesting that came in, and this may be for Candy and it may be for Debbie also, which is came out in a little earlier on. So we've talked a tiny bit about this in the OCFS project, but thinking about whether any of the projects have explored the connection between guaranteed income and CPS or child welfare involvement. And so I know that that's something that OCFS is doing. And then I'm also curious if there's research that you've seen on that at all, Debbie, as well. So I'll
sure. All right. So yeah, I'll actually tell you. So the actual questions that we are looking to answer are: what is the impact of a direct cash transfer on parental, physical, mental health, child development, and financial stability? As well, does the receipt of a direct cash transfer prevent future interactions with child welfare? So ours is very specific to child welfare, to feeling and seeing how the receipt of those funds impact those calls to what we call the SCR or the child hotline, and whether or not the individuals who receive those funds also show a difference mental health wise and all of those other areas. So I appreciate, Morales, you mentioning mental health, because that's one of the huge parts of that conversation that we were having. If you're getting a call because you can't make ends meet, certainly that's going to have an impact, right, on everything, every aspect of your life. And neglect, and other things that are generally indicated by poverty, right? We want to step in and see if we can support, right? That old adage of you don't have to report a family to support a family. That's where we're looking to head. And so yes, our pilot is very specific to child welfare engagement and involvement. And so thank you for that question.
Andy, just a question that came in was when the research would be publicly available. And I know that you're at the very beginning.
We are at the beginning. So our pilot just launched in July. And so again, 12 months for the actual, distribution of funds. And then I believe is 6 months thereafter. So 18 months total. So I would say somewhere maybe in 2025, hopefully early 2025, we'll be looking to share what we learned. So, yeah.
Maybe. All right, I'm just checking to see if there's any questions that have come in. If there are questions that you all have for each other, please feel free to jump in with those. I think we've covered a lot of the questions in the chat were about waivers and benefits cliffs. We've covered a lot of that. Joan, did you have?
I'm curious about the distribution amounts for the bridge project. You mentioned the stipend, and then like, what is the monthly distribution?
Yeah, I realized I didn't even cover some of the programmatic design pieces. So we have two different pay structures, one in New York City and then one in Rochester and Buffalo, just responsive to the different cost of living. So in New York City, our pay structure, which has changed over time, but our current pay structure is a one-time prenatal stipend of $1,500. 15 months of $1,000 a month and 21 months for a $500 a month. So it steps down, allowing participants to hopefully adjust a little bit more to the end of the program. And then in Rochester and Buffalo and in some of our outside of New York expansions, we're using a $750 a month model. So a prenatal stipend of $1,125, $750 a month for 15 months, stepping down to $375. So yeah, those are the numbers that we're working with. I think our program over the past 2.5 years, we've tested out a couple of different payment models, and we've landed where we are based on some in-house research that we've been doing. I know a lot of folks use CGIR for their research. Candy, we also are using CGIR for our first cohort. And that cohort looks a little bit differently, where we tested $500 a month versus $1,000 a month for the entirety of the program. And unsurprisingly, to folks, we found greater success with $1,000 a month. So that is where we've landed. And I think the one caveat that I'll put, which to my earlier point about kind of our policy and advocacy work, I think, as a privately funded nonprofit, we feel, very confident in our program design for our direct service program, and are also very flexible and interested in working with others around what a policy design could look like, particularly if we're thinking about something statewide and responsive to the wide variety of factors. So our direct service program, that's the design that we're going with, that we feel confident in, but really interested in kind of exploring what might be possible via state policy, and that design might look a little bit different. That was a long answer to your question, Joan, but I appreciate it.
And Steph, can you remind us when you launch in Buffalo, just so folks have that?
Yeah, December 15th. So 10 days from now, we are launching applications in Buffalo, which we are very excited about. So if folks know Buffalo pregnant individuals, please have them check out our website. We're really excited to have the support of the elected officials that represent that area. We're starting with a relatively small cohort of 50 moms in Buffalo, but interested in finding additional funders and philanthropic dollars to grow that cohort. So trying to expand to elsewhere in the state. And again, I think we will always be very focused on a specific population, but hoping to serve that specific population in every corner of the state.
Great. I'm pausing for any last questions amongst panelists.
I would say, what are some of the ways that, as New York State, Office of Children and Family Services, how could we all collaborate, and work towards, expanding and growing the pilots? I know obviously we have to wait until we, see how it all turns out for us, but I'm really curious about ways that we could partner and just, figure out how we can make this effort stronger. Because we know it works. I'm not supposed to say that, but tons of, research has shown that. So how do we get together so we can just kind of bust through the rest of this tape?
It's my favorite kind of question, Candy.
Recently launched New York Cash Coalition, that's being facilitated by Creatives New York, right, Steph? And
Creatives Rebuilt, yes. They run a cash
Creatives.
program for artists.
Oh, I've heard of it. Yes, yes, yes. Okay.
oh, we just had
Mhm.
one meeting so far, but I know we're looking to bring in really all of our New York State partners in this work.
Great. Okay.
I just actually think we got a couple of more emails today from them, so we can definitely make sure you're on the list to
That
get
would be great.
included.
Thank you very much. That would be great.
Yeah, and Candy, I would say, as a former government staffer myself, I think
Yeah.
there's nothing more powerful than folks working in government, talking to their colleagues, talking to folks at other agencies around both the work that you're doing and how excited you are about it, and also, to your point, kind of the deep, kind of decades-long research on this work more broadly. I think we are always looking for advocates inside government, municipal and state government. And, you know, for you, you have the very unique position of running your own program through OCFS, and also having exposure to some other programs. And so I will take kind of your question for us and really give you kind of a direct ask back, which I think is the responsibility for folks on the outside to our government counterparts, that as widely as you can talk about guaranteed income programs, the better, because you know, we're really trying to change hearts and minds and getting folks within kind of institutionalized systems to understand the real promise and the hope and successes of these programs. And it takes a while for some folks to wrap their heads around it. So
Yes.
conversations from trusted, you know, with trusted colleagues who they think highly of really do a world of a difference.
That's great. Thank you for that. Thank you both.
And what a beautiful way to end our conversation today on collaboration and working together moving forward. I really want to thank all of you panelists and our participants today for joining this conversation. It was such a thoughtful and insightful discussion, and I'm so grateful to each of you for giving of your time to us today. New York has committed, as I said in the beginning, to reducing child poverty by 50% in the next 10 years. Direct cash transfers or child allowances may be part of the way to do that. Today's conversation gives us so much food for thought as we move towards this goal. So thank you to everyone for joining us. Please join us in this work. You can visit the website newyorkcan.org. That's for the New York Can End Child Poverty work. And stay tuned for more conversations like this one and more work in the new year. Thank you all.
Thank you. It's a pleasure to be with you all. Take care.
Thank you.
Thank you all for your time.
Yes, thank you.